students, today we are going to start with the oral cavity ulcers. I already mentioned in my last class that about the cleft lip and also cleft palate, the management plan and the treatment plan of the cleft lip and cleft palate. Today we will discuss the oral cavity. Oral cavity is for the purpose of so many things and physiological function in our life, that by the oral cavity we chew the food, we asphyx through the oral cavity, we deglutate the food, and so many functions are there of the oral cavity. And oral cavity containing the lips, the gums, the teeth, the tongue and palate. All these things are very helpful in performing our physiological function like chewing, speaking, deglutating, and other expressing his or her own expressions. And so we will discuss about the oral cavity ulcer. So oral cavity is itself having so much bacteria, commensal bacteria are there, and as well as very opportunist bacteria in our oral cavity, because oral cavity is exposed to the environment, and it is the initial parts of our gastrointestinal tract. And so not only this, the oral cavity is having thick, hard structures, the palate, they have hard and soft structures, buccal cavity, cheeks, and all these things are in such a way that the infection also comes from the environment or come from the outside to the buccal cavity, and trauma of the mucous membrane of the buccal cavity can take place, and this trauma will give rise to the ulcer in oral cavity. So what are the ecological factors? That most of the ecological factors in the oral cavity, that the trauma of the buccal cavity by the chewing process, by the speaking process, or by whitening of the teeth of the mucosa of cheeks and oral cavity, that makes the ulcer. And ulcer is very common in our oral cavity, and so many infections, bacterial infection, fungal infection, and even the viral infection can cause ulcer in our mouth or in our buccal cavity, and manifestation of so many organic diseases also cause ulcer formation in the buccal cavity. So these are the ecological factors of becoming the common site of ulcer in our oral cavity. The classification, you can do the ulcers of the buccal cavity into the main two groups, that is non-specific group and a specific group. Non-specific groups, that is the trauma is the most common, that due to the mastication, due to the chewing of the food or taking the food containing so many bacteria. These are all the factors that cause the trauma of the mucosa of the buccal cavity, and that makes or manifest as a ulcer formation, and this is called traumatic ulcer of the buccal cavity. Not only this, the mouth containing the teeth with very hard structures, and when there is sharp or decay of the teeth, that erodes the mucosa of the buccal cavity and makes the traumatic ulcer in our buccal cavity. The pertussis is the one disease that also causes infection of the buccal cavity, because pertussis, anti-pertussis drugs, or when child is suffering from pertussis, whooping cough, then there is intractable coughing, taking out the tip of the tongue outside, and in this way there is trauma of the under surface of the tongue with the incisor teeth, and this incisor teeth for long times remain in contact with the under surface of the tongue and makes ulcer, and this is called post-pertussis ulcer. So traumatic ulcer, post-pertussis ulcer, aphthous ulcer. Aphthous ulcer is also very common. It is the bacteria, it is the viral infections, and cause ulcer, manifest as a ulcer formation in the buccal cavity or on the tip of the tongue or on the side of the tongue. The dental, I have already mentioned, that is sharp teeth, ill-fitting dentures, or the decaying of the teeth, losing of the teeth and sickening of the teeth, all which cause the malfitting of the teeth, or even the dental or artificial teeth can cause eroding of the undersurface or the buccal mucosa and cause formation of the oral cavity ulcers. Now there are some specific ulcers are also that manifest the ulcer in the buccal cavity. These are the tuberculous ulcers, that is the tuberculous ulcer is always secondary in the buccal cavity, and when there is active tuberculosis in the lung, or when there is lung tuberculosis is there, cupping out of sputum, and this sputum is loaded with tuberculous bacilli, and that comes in contact with the buccal cavity and the upper surface or the dorsal surface of the tongue, and the tuberculous bacilli get embedded into the tongue or the mucosa and forms the ulcer that is called tuberculous ulcer. Second one, the syphilitic ulcer, a specific ulcer is the syphilitic ulcer. Syphilis nowadays very rare condition, or it is treated very promptly in these days, but in the old days when syphilis is not getting proper treatment, when there was no proper treatment for the syphilis in old days, then all three stages, that is primary, secondary and tertiary stage, all manifest as the ulcer formation. The primary stage of the syphilis that makes the Sankar ulcer is the button-like and indurated base and margins and edge, and it is pelvis, and it mainly takes place on the lips and also on the tip of the tongue, sometimes on the sides of the tongue also suffer from the primary Sankar, that is the Sankar ulcer. This secondary syphilis also cause oral ulcer, that the multiple small ulcers in formation is there in the buccal cavity in the secondary stage of the syphilis, and in secondary stage of the syphilis these small ulcers collide to each other, and after collision of each other it forms a ulcer, and it is a snail tract ulcer, that the pathway looks like a snail walking on the sands, and so it is called syphilitic ulcer in the second stage or the secondary stage of the tuberculosis, and this syphilis is causing snail tract ulcer in the secondary stage on the buccal cavity. Third is the third stage, tertiary stage, that is gamma formation. Gamma ulcer is also manifest in the buccal cavity and the mucocutaneous junction, that is at the tip, at the lower lip or the upper lip, or maybe on the dorsum of the tongue. This tertiary stage of the syphilis that makes the gamma, and this ulcer is mostly occurs on the dorsum of the tongue. The malignant ulcer, a specific ulcer, is another type of ulcer that takes place in the mucous membrane, and mucous membrane is a very common site for the malignant ulcer, that is due to the chewing of the metal, smoking, and imbibing of the alcohol, and syphilis and other infections are more prone develop into the carcinomatous ulcer, and these are the pre-malignant conditions. Leukoplakia is pre-malignant conditions of the carcinomatous ulcer, and carcinomatous ulcer is mostly common in the person who is having chain smoker, who is having alcoholic, and who is having very spicy food, and repeated attack of the other types of ulcer, chronic ulcers, or traumatic ulcer for the long period of irritation of the mucosa of the buccal cavity by the sharp teeth or by the denture for long times may convert it into the syphilitic ulcer or malignant ulcer, and this malignant ulcer is very serious conditions of the buccal cavity, and thus the specific ulcer, this malignant ulcer, takes place. The acute ulceration in some of the diseases, that is in the gingivitis or the ulcerative colitis and other some autoimmune disease also manifest as the ulcer formation in the buccal cavity. So you can classify the ulcers into the two groups, that is the non-specific ulcer and a specific ulcer. In non-specific ulcer is the traumatic ulcer, post-pertussis ulcer, ectus ulcer and the dental ulcers. These are the non-specific ulcers of the buccal cavity, and the specific ulcer are tuberculosis, syphilis, all three stages, primary stage, secondary stage and tertiary stage. Malignancy is the another specific ulcer that affect the buccal mucosa or lip or tongue or even any parts of the mucous membrane, and acute ulceration occurs in case of the many organic diseases in our body, and so these are the specific ulcer. This is classification. Now come to the site of the ulcer. Where in buccal cavity having tongue, lip, mucus, cheeks and all these things. So what are the common site of ulcer formation in our buccal cavity? Tongue is the most mobile organs in our body, and it is always dynamic structures and always moves in our body, and it makes us to speech, make us to deglutitate food, make us to chew food, and so many functions are there with mobile structures, and so it is very prone to the tongue is very prone for the ulcer formation and trauma to the other structures, and so the more or less all parts of the tongue is very prone to ulcer formation. On the dorsum of the tongue, I already mentioned the syphilitic ulcer and tuberculous ulcer is very common on the dorsum of the tongue, because in case of the syphilis, the snail tract ulcer, the secondary stage of the syphilis, they occurs on the dorsum of the tongue, and also tuberculosis, because the tuberculosis is always secondary. Tuberculous ulcer of the tongue is always secondary to the pulmonary tuberculosis. So the sputum lurid with the tuberculous bacilli that come in contact with the mucous membrane of the tongue cause the inflating of the tuberculous bacilli and cause ulcer formation. And this tuberculous ulceration is on the dorsum of the tongue mostly. And so the most common site in the tongue, the dorsum of the tongue, that is suffer from syphilitic ulcer and tuberculous ulcer. The sides of the tongue is also very prone to become ulceration because it is mobile part and remain in contact with the teeth, upper jaw or lower jaw, and so when there is any trauma or when there is any sharp teeth or decaying of the teeth or denture, that always cause irritation of the side of or the margin of the tongue, and also when there is any sharpness of the teeth or any undue filling of the teeth, that always our tongue try to fill it and cause ulceration of the side of the tongue, and also sometimes the malignant ulcers sometimes also affect the margin of the tongue, but it is very less common rather than tip of the tongue and dorsal of the tongue. The ventral surface of the tongue is also very prone to become ulcerated by the post-pertussis ulcer. Pertussis ulcers, that is the whooping cough. When the child having teeth, when cough interactable, that always is coughing for long times and protruding out his tongue from the mouth during coughing process, and then there is always rubbing of the under surface of the tongue, that the ventral surface of the tongue on the sharp edge of the incisor teeth, lower incisor teeth, and then cause ulceration formation when it remains contact for long time, and so post-pertussis ulcer occurs on the ventral surface of the tongue. So the tongue is the most common site for oral ulcer, and it is of great importance. The other side of the lip is the another common site or under surface of the lip, carcinomatous ulcer, that also occur in the under surface of the lip, that when betel chewing or the candy chewing or tobacco chewing, putting the under the surface of the lip, and that cause irritation and carcinomatous stages will take place, leukoplakia first and then leukoplakia, that is the pre-cancerous condition, makes carcinomatous ulcer under surface of the lip and gum, and also it affect the cheek and mucosa of the cheek also. The another, that is lip and cheek is the another side for ulcer formation, oral ulcer that occurs also in the cheek due to the so many diseases, that is the trauma, the smoking, or the alcohol taking, or sometimes some organic diseases that manifest the ulcer formation in the cheek, and it is very painful. Cheek is also get infected or get ulcerated by the sharp teeth, the upper side of the jaw or teeth, molar teeth can cause the irritation of the cheek, and that will make the ulcer formation. If it is not treated properly and remain for a long time, may transfer into the leukoplakia, the cancerous condition, and in the last, if it is neglected, then carcinoma of the cheek can take place. And so these are the common side of the ulcers in the buccal cavity, that is the tongue, lip and cheek. Now come to the clinical diagnosis. How will you diagnose clinically the ulcer of the tongue? And when there you should take the history. That clinical diagnosis contains the history and examination of the patient. History you should take proper way and very patiently from the patient, because the patient is not telling their exact history about the ulcer formation in the buccal cavity, and so history should be taken properly in the child, in the patients. And history way, that means you could ask about the main complaint of the patient, that if there may be pain in the cheek or pain in the tip of the tongue when ulcer formation is there, and you also ask about the personal history. Personal history is of great importance in case of the diagnosis the ulcer of the oral cavity, because so many personal habituation, that is the smokers, that is chain smokers, suffer from ulcers of the tongue, and also the alteration of the mucosa of the buccal cavity, and that will lead to the ulceration formation, and later on malignancy can take place. And so the betel chewing is the another personal history, and also the tobacco chewing. These are the smoker, the betel chewer, and the tobacco taking. All these are very common and very important. Asking the personal history of the patient when you are taking the history of the patient. Duration of the ulcer should be taken, because the acute ulcer remain only 3 or 4 days within a week. That is some ulcer, that is viral ulcer or some other ulcers that remains, or even the alcoholic ulcer that remains for a week or 2 and become healed very nicely and no spillage is left. But in case of the traumatic ulcer, or when there is irritation of the buccal cavity for long times, and if it is neglected, that cause chronic ulcer and non-healing ulcer, and this non-healing ulcer is manifested by the fibrosis, and later on leukoplakia takes place in pre-malignant condition, and that will transfer into the carcinoma of the cheek or the buccal cavity where ulcer is situated. And so proper history should be taken to the patients, and past history also should be taken properly, because past history, sometimes the patient is having sharp teeth in long times and later on develop ulcer, and so the proper history should be taken for clinical diagnosis. The examination of the ulcer is very important when you are examining buccal cavity. If there is ulcer, you should examine it properly. You first inspect and spend a few minutes for examining, inspecting the ulcer properly, that ulcers in the बोलिए क्लास ले रहे क्लास में कहाँ ले ठीक है So the size of the ulcer, that it manifests that they acute ulcer, that is the ulcer due to the alcohol or the viral ulcer, small and multiple will be there, and so the oval shape of the ulcer is mostly oval or maybe irregular. In case of the irregular ulcers, the carcinomatous ulcer is always irregular in shape, but in case of the tuberculous ulcers or in case of the syphilitic ulcer, the syphilitic ulcer is just like a snail track ulcers that is walking of like a snail pathway, and so the shape of the ulcer is different in case of the different ecological factors. The tuberculous ulcer is undermined, oval or maybe a small, and the age of the ulcer is also important because it is punched in case of the syphilitic ulcer, it is undermined in case of the tuberculous ulcers, and in case of the malignant ulcer, the margin is everted or age is everted, and so examination, after examining the ulcer, the size, shape, number, and in duration, margin, and also you should also examine the discharge, which type of discharge, serous discharge, purulent discharge, that is the acute ulcer or inflammatory ulcer cause purulent discharge, bacterial condition that cause the mucus discharge from the ulcers, and then at last you should also examine the lymph node, the surrounding lymph node. There is some mental lymph node. The most affected lymph node in case of the oral cavity ulcer, that include some mental, some mandibular, and other structures, other lymph nodes are affected in case of the oral cavity ulcer. That is the lymph node into the vicinity of the buccal cavity, or that is in the submandibular, that is submental and others. And this should be investigated properly. After examination, you can diagnose the case, and then a special investigation can be done for the proper diagnosis, clinical diagnosis of the ulcer. That ulcer, first you examine the blood of the patient, that you do the TC and DC in case of the differential counting of the blood cells that lead to the lymphocytosis in case of the tuberculous ulcer, but in case of the acute ulcer or bacterial ulcer that cause polymorph leukocytosis, polymorph large and great in number, but ESR is nil in case of the tuberculous ulcer, and VTRL is positive in case of the serum, VTRL is positive in case of the venereal ulcer or in case of the syphilitic ulcers, and in case of the other venereal diseases. The bacteriological examination should also be done, that the pus culture and sensitivity should also be seen, and to know the bacteria, which type of bacteria is common in formation of the ulcer, and then you can use the proper treatment by the sensitivity test, and also you can make the smear of the discharge that will cause visualization of the causative organism in case of the syphilitic ulcer, that the Treponema pallidum, the causative organism of the syphilis, that will be seen like silver threads in case of the bacteriological examination in the smear, and you can diagnose that when the syphilitic ulcer is there, then you will take the discharge from this ulcers and make a smear on the slides and see under microscope, under ground glass appearance, that cause the silver-like appearance of threads into the under the microscope, and this will diagnose and recognize the Treponema pallidum in case of this syphilitic ulcer. The biopsy in case if the ulcer is for long times and refuse to heal, an healing ulcer in the buccal cavity, then or if the margin is inverted, you can take a chunk of the tissues from the ulcers, and then you do the biopsy whether it is due to the malignant condition or there is any change in the nature of the cells, and you can diagnose whether it is tuberculous or whether it is carcinomatous ulcer or not. So you take the blood for investigation, bacteriological examination and biopsy. Last one is the X-ray. You can do X-ray of the mandible or X-ray of the other surrounding structures, and CT scan can be done, but these all things have been less important in case of the formation of ulcer, but in case of the carcinoma of the tongue or in carcinomatous ulcer of the lip or buccal cavity, you can do the MRI and also the CT scan that will say about the extent of the lesion and metastasis of the lesion, and then you can diagnose it, the staging of the carcinomatous ulcer in case of the buccal cavity or in the tongue. So these are the investigation which can be done in case of the oral cancer. Now details of the particular ulcer, just we will have already mentioned details of every ulcer, but we will just having a few details about the dental ulcer. Dental ulcer always occurs on the side of the tongue, and it is due to the ill-fitting dentures or maybe due to the trauma of the sides of the tongue, and it mostly occurs on the sides or on the tip of the tongue. It is oval, more or less regular in condition, it punched out, and then this dental ulcer is can be treated by removing the ecological factor. If sharpness of the teeth is treated properly or the ill-fitting dentures is removed, then the dental ulcer will heal itself. The Ephthus ulcer is the another ulcer that may cause also affect the tip of the tongue, and it is due to the viral infections, and these are of Vincent, that is the Ephthus major, Ephthus minor, and the Vincent, that is viral diseases that the virus can cause the Ephthus ulcer, multiple ulcer, maybe single ulcer or multiple ulcer. In case of the minor, only one or two ulcer in the buccal cavity, and that will be healed within a week, and there is no sequelae, no scarring, no other sequelae is there. But in case of the post-prosthesis, in case of the major Ephthus ulcer, that is cause multiple ulcers as they are remain for a long time, even 1 or 2 weeks, and then healing will take place with the fibrosis. And so this post the Ephthus ulcer should be treated properly by antiviral drugs, oral hygiene, and other things. The post-pertussis ulcers I already mentioned in my examination, clinical examinations of the patient, that the when there is whooping cough or pertussis to the child and coughing out always, protruding the tongue, and that causes irritation of the under surface of the tongue, cause ulcer formation, and this post-pertussis ulcer is always on the rectal side or at the frenulum limb, tip of the frenulum limb, and it should be treated by treating the whooping cough properly, and when whooping cough is treated properly and successfully, the post-pertussis ulcer will be itself. The syphilitic ulcer is another ulcer that may affect all three stages I already mentioned in my clinical examination of the syphilitic ulcer. That is the 3 stages is there. Primary stage, that is center formation, that occurs on the tip of the tongue or maybe on the lip and at the side of the contact, mostly occurs in the genitalia, but in case of the buccal cavity it can also occurs with the kissing of infected person, that is on the tip of the tongue or on the lip of the tongue. Then center formation is a small ulcer, single ulcer is there, painless ulcer, and it is round or circular and the margin is just like indurated and button-like and firm in filling. And so the primary stage, in the secondary stage, that is the snail tract ulcer, that ulcer takes place in the buccal cavity after the 3 or 4 months or 6 months after the primary sphincter, and then the formation is the dorsum of the tongue or in the buccal cavity, and this syphilitic ulcer, that is the snail tract ulcer, multiple ulcers formation in the tongue or cheek and collide to each other and form a ulcer that looks like the snail tract, and it is called second stage of syphilitic ulcer, that is snail tract ulcer. In case of the tertiary stage, that is gamma formation. In case of it also occurs in the dorsum of the tongue and in the buccal cavity, and this also forms a chronic ulcer and refuse to unless or until you will treat the cause properly. So this about the treatment. Symplectic ulcer, tuberculous ulcer, already mentioned that it occurs always secondary to the pulmonary tuberculosis, and during coughing, when the cough is permanent process, the cough is loaded with the tuberculous bacilli, and this tuberculous bacilli come in contact with the mucous membrane of the buccal cavity and also the tongue, and invading of the tuberculous bacilli into the tongue or in the buccal mucosa, and formation of the tuberculous ulcer that is underlying antidural in shape and mostly affect on the dorsum and tip of the tongue. The malignant ulcer is always on the sides of the tongue more and tip of the tongue, and then this malignant ulcer mostly occurs in the old age and due to the brittle chewing or the chain smokers, and also the person who is imbibing the alcohol always. And so in this case we have just finished the oral cavity ulcers. I would like to sum up whole of the session that when you are discussing about the oral ulcer, you must examine how to examine clinically and take the proper history of the patient, and also you examine the ulcers properly by inspection and palpation. Then you do some investigations, that is the blood examination, PCPC, SR, biliary, and also the bacteriological examination, burst ulcer and smear formation, and then you can diagnose the tuberculosis and also the syphilitic positive organism. You should also do the biopsy and radiology, and then the details of the particular ulcer, dental ulcer, rectal ulcer, post-tuberculosis ulcer, syphilitic ulcer, tuberculous ulcer, and malignant ulcer. So this is all about today. Thank you.